Hey y'all, welcome back to our channel.
I'm Matt Digman.
And I'm Roddy.
We released our debut novel, The Dark That Dwells, in July 2020. And when we aren't busy working on the next book in the series, we share knowledge and know-how from our day jobs as pediatric emergency medicine physicians in our series, Doctoring the Books.
Our goal? To help you add some realism to your fictional injuries and illnesses.
In this companion to Doctoring the Books, we're sharing fast facts about various topics to help with your writing process, just like they help ours. Today, we're going to quickly cover the topic of splints, so you can have your characters manage their musculoskeletal injuries as authentically as possible.
A splint is any collection of materials you could use to immobilize an unstable bone or joint following a fracture, dislocation, or overuse injury.
This could be anything from a cardboard box with tape, some sticks and rope, or any of the various modern materials used, such as fiberglass, flexible aluminum, or even air-filled bladders. Splints temporarily immobilize in a way that allows for swelling, permitting soft tissues to expand without constriction. You might wear these for a few days or just a week.
A cast is a more complete and semi-permanent version of a splint, designed to give circumferential support and protection.
They're rigid and provide a barrier against moisture and physical damage. These can be worn for weeks or months at a time depending on the fracture.
The goal with either is to keep moving parts in place to allow for healing and prevent any sort of neurovascular compromise, that is, damage to the surrounding nerves, arteries, and veins.
While there are many different types of splints for all sorts of situations, the basic tenet of splinting involves immobilizing the joints above and below the fracture site if possible to best restrict movement and limit further damage. For dislocations, keeping the joint itself immobilized after reduction should suffice. And in general, if it's a fracture or dislocation in a lower extremity, you probably won't want to have your character bearing weight on it, even after the splint is placed.
Like we mentioned, if you have a character who suffered a broken bone or a dislocated joint and they aren't heading immediately to a hospital, like you definitely want to do in real life, you can have them apply a splint to manage things temporarily, especially if they're on an epic quest and they don't have time for a detour to the nearest urgent care.
Otherwise, they run the risk of the neurovascular compromise we mentioned, or other sequelae including damage to the surrounding muscle and complications such as compartment syndrome, bleeding, infection, or tissue death. If you want to look particularly savvy on the subject, here's a pro tip. If there's a broken bone and you want to give your character the best chance at healing their injured extremity, have them undergo a closed reduction prior to placing the splint.
What's this mean? Closed refers to the fact that the skin covering the broken bone isn't punctured, lacerated, or compromised in any way. If it were, that would make this an open fracture. Reduction means putting the bones back in place as best as your characters can in order to optimize appropriate healing.
In a hospital, this is done under fluoroscopy so they can ensure perfect positioning. If your character is someone that might have knowledge about correct alignment, they can attempt one of these field reductions. Otherwise, just getting things immobilized is still a good start and can reduce the risk of doing any further harm to your poor protagonist.
Joints are similar. If there's displacement, they've got to be reduced as quickly as possible to minimize potential adverse outcomes.
Shoulders, knees, hips, and ankles come to mind here.
After any type of reduction in real life, we perform a neurovascular check to make sure that the tissue is still adequately supplied by the vascular network proximal to the injury and reduction site, and that sensation is still intact. We also do this after applying a splint or when moving the patient. Even adjusting them in bed or on a stretcher can cause things to shift just enough to compromise blood flow. It's just something to keep in mind if you want to add one of these tidbits to your tale.
Once the painful process of reduction is complete, you want to first wrap the area with some padding, something like cotton gauze or other soft material, in order to protect the skin and any bony areas from rubbing that can cause painful ulceration and skin breakdown. If your characters don't have cotton, imagine some futuristic material that is soft and breathes, or some ancient material that might be readily available.
Then, you want to use some form of sturdy, rigid material to form the actual splint and secure it in place. In the hospital, we typically use either fiberglass or plaster held in place by an elastic bandage. In your story, feel free to get creative with whatever your character has access to, so long as it's relatively sturdy and long enough to cross the joints.
If you don't pad the area well before placing that immobilizing portion, you run the risk of causing pressure ulcers that can become painful at best and infected at worst.
Also, make sure you don't secure the splint too tightly. This can also cause nerve or vessel damage. Well guys, this concludes our quick survey on the subject of splints. While it won't serve as a how-to for splinting, it should provide an overview of the general principles used in the process.
Unless your drama requires a detailed step-by-step explanation of a character applying a splint, this should be enough to add a sprinkle of realism.
If you do find yourself writing something that needs a little more detail, feel free to message us for a more in-depth explanation. And be sure to comment below and let us know what you'd like to see in future installments of our Fast Facts.
As always, please be sure to like this video if you found it useful, and be sure to subscribe and hit that bell icon for notifications so you'll know each time we drop new content.
And with that, we'll see you all next time.
Bye!